I'm going to talk about the effects that COVID-19 had, mostly in the US, but we know it impacted the world. So, first, I'm going to go through a timeline real quick. There's a lot of events that happened in this timeline. I kind of chose some of them. Okay. So, in late 2019, that's when patients in China began to get sick with pneumonia like symptoms. And they figured out that they were not responding to traditional treatment. In early 2020, more than 40 cases were identified in China, and the first death was reported. The World Health Organization finds evidence of possible human-to-human transmission, and then the virus is reported in four Asian countries. By then, China was placed under lockdown due to the coronavirus outbreak. Then WHO's International Health Regulation Emergency Committee meets and decides not to declare the 2019 coronavirus a public health emergency. Instead, they decide to monitor the situation. But 9 days later, they declare the coronavirus an emergency, an outbreak, and public health emergency. In mid 2020, the World Bank states that the COVID 19 pandemic will force the world economy into a recession that is worse than the one that went on after World War II. Then, more than 200 scientists signed a letter asking the World Health Organization to include a warning about airborne transmission in the guidelines. So, the scientists were trying to get WHO to understand that the virus can be transmitted through the air, right? Not only contact, but airborne. Then the CDC asked that people wear cloth face masks to prevent the spread. After that, deaths exceed 1,000 deaths per day. So that's a lot of people dying in one day. Then in late 2020, the US and China declined to join the COVID-19 Vaccine Global Access Facility treaty or letter proposed by WHO. What this was is they were trying to get vaccines to be available for everyone in the world. It didn't matter if they had money, if there were countries who were poor or countries who were rich. They just wanted to get the vaccine out there to get people vaccinated to prevent dying from this virus. So the US and China declined, but later they decided to sign the treaty or contract. Then vaccines become available to certain groups, and the vaccines are not distributed as fast as or as quickly as they were expected to be. By early 2020, because of vaccine shortages, scientists at several places or institutes decided to work on vaccines to double the amount to make available for people to prevent future shortages. By April, more than 200 million doses were administered in the US. By mid 2021, the vaccine is authorized to be administered to youth 12 to 15 years old. Then the Title 42 goes into effect in the US. This means it actually affects immigration. So back then in 2021, people were allowed to immigrate into the United States, people who were seeking asylum, mostly from Venezuela. When COVID-19 comes in, they do Title 42, which was like, they closed the border. We cannot accept anybody. So that's when most of them stayed in Mexico. In late 2021, more than 140,000 children in the US lost their primary or secondary caregivers, and a lot of them were orphaned. In November, it is found that the virus can be spread between people and animals. In early 2022, in one month, the daily average in the US spikes from 119,215 to 805,62. Okay. Um, then mental health among adolescents significantly declines. By mid 2022, WHO estimates 15 million direct or indirect deaths globally from January 2020 to December 2021 that were caused by the pandemic. Later, there was a 35% increase in the firearm homicide rate during the pandemic. So there were more deaths due to people killing, right? Homicide. The global market for the N95 masks is predicted to reach 11.8 billion by 2026. Then the Moderna vaccine is recommended for everyone ages 6 to 17 years old. So I'm going to talk about the three most important aspects and the consequences that generated from it. So even though health authorities knew there were no traditional cures for the early outbreaks and that it was possible to have human to human contact, they decided not to close all the borders to prevent contact. And number two, the virus propagated faster than the authorities could have prepared for. So it was kind of like hard to prevent. And then the virus caused major human loss quickly. So what I would have done differently to prevent it. This is me thinking in a perfect world where I'm not obeying any laws, any international treaties, any nothing. Okay, so I would have called it a state of international emergency as soon as I saw that traditional treatment wasn't working in China, and I would have prevented my country, right, from being infected that way. I think because the US is a major place, all the flights getting there or going from there to Asian places, we could have prevented that instead of just like taking 9 days to think about it. It took too long. I also would have used social media and like media in general to educate people. So in the news, instead of focusing on everything that's negative and how the pandemic was so bad and how we cannot stop it, I would have used it to educate people and to keep them updated with real sources, right? With true information about the pandemic. So that they could prevent it in their homes. And then, because like the early stages in the US, I remember people were like, I don't think this is a pandemic. I have my right to wear or not a mask. I have my right to be vaccinated or not, which is all respectable. But I think once people are educated about a topic, they can make better decisions about it. Also, with the COVAX, even though many countries signed it at the end, I would have done something to come into effect faster. So I know this is an economic thing and we cannot stop that either. But to make vaccines available for countries that are not world power, right, would have been good. And that would be it for my presentation. I am going to share with you my bibliography. This is where I got the information about the timeline, and this is where I got the images. Thank you.